If you are soon to deliver your baby, imagine those first moments holding her on your chest. Take your time to cuddle her as she begins to search for your breast. Her highly developed sense of smell searches for the scent of your milk, which is unique in each mother and familiar only to her own baby. For this was the same unique fragrance your baby has known for months while bathing in your protective amniotic fluid. By instinct, breastfeeding right after delivery is the way all newborns of all mammals give protection to their young and prevent serious feeding problems such as having too little milk. It's this first hour that's most important. Your baby has been held all of her life. Contact with you is exactly what she needs. Nothing's more important than a mother's touch. How you can use your hands to help with breastfeeding is what you'll learn here. You can remember 3 easy points. Let's call them A, B, and C. How can you help her latch onto the breast comfortably and effectively? Let's call this A, attachment. This is important. You see, the way a baby gets milk from a breast is not by using the nipple as a straw, but by using her jaw and tongue to massage underneath the nipple. The nipple is protected far back in her mouth, and milk is easily expressed. If the nipple is closer to the lips, it becomes compressed and less milk is expressed. Many babies manage this without any help, especially when given uninterrupted time on their mother's chest right after birth. Others, and this is very normal, need a little hands-on help to gently guide the breast comfortably back into her mouth. Just like that. Squeeze a little colostrum out of there for her. Beautiful. You can use your hands to support your baby and your breast. One hand shapes your breast to fit easily into her mouth. The other hand guides her to the breast just when she is ready with a wide open mouth, so she can easily latch on to the breast and not just the nipple. How can you make sure you produce a rich supply of milk to feed her? Let's call this B for breast milk. It is the frequent expression of drops of early milk beginning in the first hour that trigger your milk supply to increase in several days. The critical sign to your breast to make a lot of milk later on is to remove the small amount of first milk early and frequently. Hands can be better than a pump to massage out the small amounts of thick and creamy early milk. Where you place your fingers and how you press will make a difference. Hold your hand in a C shape, as if you were holding a cup. Your nipple is in one line between the pads of your thumb and first finger. There are 3 steps: pressing back towards the chest wall, compressing the pads of your fingers together, and then relaxing your hand. Your thumb and fingers press and massage the milk-producing lobules. This stimulates the slow movement of rich milk into the ducts. Compress the fingers together a little tighter each time, and slowly the drops begin to flow. A day or 2 before you are due to deliver, you can practice to become comfortable with this technique. You may even get a little milk. How can you make sure she is getting enough of your milk? Let's call this C for calories. For most protection, babies take frequent small feedings of early milk before your supply increases. Early weight loss is normal and will be followed in the hospital. Weight gain and bright yellow breast milk poops should be expected by day 5. You can never breastfeed too often. If she still needs more, even after you've nursed her well, she will show you by continuing to suck even after you've taken her off the breast or put her down. Don't worry, you can help her. To prevent more than normal weight loss or jaundice, or just to make her a bit more content, either feed her again or finish the feed with dessert from a spoon. Feed her until she is perfectly content. This simple remedy will not interfere with her breastfeeding and will give her more milk and signal your breast to make more milk. The more frequent, the better. Once your supply increases, she will take all she needs while breastfeeding.
Yeah.
The truth is, if your baby's not a strong breastfeeder from the first hours, you and your partner have all you need and are in the best position to begin using your hands to take care of her, just as naturally as you will do throughout her life. Begin soon after delivery, so she gets your first milk now, and you will make plenty of milk in the future. Cesarean-born babies, small and early babies, and babies who are separated from their mothers especially need your helping hands. A cesarean-born baby placed skin to skin on her mother's chest in the operating room may need longer than the first hour before she is ready to feed. Be patient and follow her cues. For some babies, gentle touching and guidance from you or your partner may help. Likewise, small and early babies, those weighing less than 6 pounds, or those born before 37 weeks, tend to be sleepy babies at first, almost too good.
Keep going. So she keeps falling asleep. Come on, Riley Bear.
They usually wake up, so to speak, and become strong breastfeeders once your milk increases and flows easily. Until your baby, who is not a strong breastfeeder initially, becomes a dependable nurser, pay attention to two things: boosting your milk production and offering her your milk. Simply start early and hand express frequently, even just tiny drops, and finish breastfeeding with your milk from a spoon. Breastfeeding your early baby or your cesarean baby is much like growing a garden. With your hands, cultivate a rich supply of milk for her, and as she thrives, she will blossom into a natural breastfeeder. One last thing. Sometimes things don't go exactly as you had hoped for. For mothers who are separated from their babies or have problems with attachment, this first hour matters the most. Remember, the critical signal to your breast to make lots of milk later on is to remove milk early and frequently. Your partner can help you get started. Push down and relax. Isn't that beautiful? Now, Shelley, show us how you do it on this side.
Okay.
Remember? Because the hormones of delivery make hand expression easiest during this hour, the signal is very strong. Another pair of helpful hands can be really valuable. Use your hands and do just what your baby would do. Remove the precious small amounts of milk from each breast. The more frequent, the better. Alternate right breast for a minute, then left, then back to right, and so on. Use the same press, compress, relax technique. Don't worry about collecting every drop, because the more milk out in the first hour, the more milk in as milk increases. A small towel with the extra drops can be placed beside your baby's face as a calming reminder of you. Whatever milk you do manage to collect, ask to have this given to your baby as soon as possible. Keep expressing every 2 to 3 hours. This is how you place your order for a good milk supply in the future when your baby is ready to breastfeed. Of course, you can't know exactly how your own delivery will go, but one thing is for sure. Simply by using your hands in the first hour, you can accomplish these 3 goals. A. Attachment. Help your baby with a comfortable and effective latch. B. Breast milk production. Signal your breast to make plenty of milk under any circumstances. And C. Calories. Make sure your baby receives that first milk when it comes most easily. Understanding just these points is pretty simple and exactly what matters most from the very first hour.